Hi, I'm Morgan, and let's talk about Medicaid and Medicare. First, we need to learn about the United States healthcare system. The United States healthcare system is a mixture of a market justice and a social justice. A market justice distributes healthcare through market forces such as the supply and demand. On the other hand, a social justice, healthcare is distributed by government-run programs. Because we have this type of healthcare system, citizens must pay for their medicine or pay for a third-party payer, also known as insurance. This hurts those who are elderly, disabled, or even poor because they often cannot afford to pay for any insurance. That is exactly where Medicare and Medicaid come in. There are very big differences in Medicare and Medicaid. But first, let's talk about Medicare. Those who are eligible for Medicare are people 65 years or older, disabled citizens, citizens who have end-stage renal diseases such as ALS or Lou Gehrig's disease, and there are also different parts of Medicare that an individual may enroll in. Part A, Part B, Part C, and Part D. Part A is for hospitalized patients, skilled nursing facilities, hospice care, and eligible home health care. General services that are necessary to keep patients living, and it does not include long-term care. People are automatically enrolled when they hit age 65. Part B, on the other hand, has a monthly premium of around $130 to $150. It has no benefits from Social Security. A monthly premium actually depends on the income of an individual from either their Social Security or if they are working. It covers medical services that are needed to treat your specific health condition. It does not cover defensive medicine. Part C, considered Medicare Advantage, there are options for which plan one decides to go with, such as HMOs or PPOs. An individual must first have Medicare Part A or Part B to even be eligible for Medicare Advantage. No citizen with end-stage renal disease is allowed to be in Part C, and it provides more benefits such as dental, vision, hearing, and some Part C plans include prescription drugs. Now on to Part D. Part D covers drugs. It helps enrollees pay for their prescription drugs. Many assume that most of their prescription drug costs will be covered completely. An individual must have Part A or Part B of Medicare. They must live in a Medicare Part D prescription drug area where the service is actually provided, and Medicare Part D provides initial coverage limit, and they will pay for your prescription drug limits until you reach that limit. Now that you get the hang of Medicare, let's go on to Medicaid. For Medicaid, those who are eligible must be a U.S. citizen, could either be blind, have to be 65 years or older, have disability. Note that the disability is determined by an income using the Supplemental Security Income, also known as SSI methods. Low-income families, note this includes pregnant women, children, parents, and senior citizens. Facts about Medicaid is that enrollees usually get care through a managed care organization. Enrollment varies per state. It is like a branch off of Medicare, except it offers even more services. Inpatient, outpatient hospital services, EPSDT, family planning services, transportation to medical appointments, and midwife services. And lastly, out-of-pocket cost depends on one's income. It can be as low as $2.50 for a deductible or even $4 for a copayment at an MCO or an HMO. There's a large amount of debate over Medicaid due to the Affordable Care Act set in place by the Obama administration. Please watch this video all you need to know about the Affordable Care Act to explain more about Medicaid and the Affordable Care Act. The top 10 facts about the Affordable Care Act. Fact number 1. The Affordable Care Act was set in place by the Obama administration. Fact number 2. Most cities benefit from the Affordable Care Act in comparison to rural areas because there are more doctors' offices and medical facilities in urban areas. Fact number 3. The Affordable Care Act made restaurants with 20 or more food chains to have a calorie count next to items on their menu to avoid obesity and having people choose healthier options. Fact number 4. The Affordable Care Act is known for redefining the meaning of poor, which in turn helps people qualify for Medicare and Medicaid. It also required employers with 50 full-time employees to provide insurance for their employees. Fact number 5. There's an increase in jobs after Obamacare because more diagnosing and treating jobs were needed in the medical field. They were needed because many more people now have access to health care. Fact number 6. The Affordable Care Act requires citizens of the United States to have health insurance. If a citizen fails to do so, they'll have to pay a fine. Fact number 7. The Affordable Care Act created health insurance markets run by the federal or state governments. The insurance market allows customers to see the differences in insurance plans and prices. Fact number 8. Through the Affordable Care Act, women no longer have to pay more for insurance than men. Fact number 9. According to Ezra Klein, author of the 11 Facts about the Affordable Care Act, the Affordable Care Act is estimated to cost over $1 trillion within the next decade. And fact number 10. The Affordable Care Act hoped that private insurance would be the main insurance and that more individuals would enroll in private insurance. However, that was not the case, and more individuals ended up enrolling in Medicare and Medicaid. Now, this was all set in place when the Obama administration was in office, but now the Trump administration is in office, and Donald Trump plans to change the Affordable Care Act completely. In fact, Donald Trump's administration plans to put in place health coverage that costs lower for the government and citizens, which many presidents intend to do this, which is healthcare reform, but it's hard to see this follow through because of the difficulties. Now, thank you for watching, and please keep a lookout for any changes on the Affordable Care Act that the Trump administration plans to make, because it will affect your grandparents, your parents, and even you and your children in the future. Now that you all watched that video about the Affordable Care Act, does anybody have any questions? I am just a little bit confused about the deductibles. How much is the deductible normally? That is a very good question. Often, if someone has both Medicare and Medicaid, Medicare will pay for the medical payment first. Following that, Medicaid will pay the rest. This will lower the deductible if an individual has that. I cannot tell you how much everyone's deductible is because it depends on an individual's income. It can range from $2 to $300. So if an individual still has Medicare and Medicaid, their deductible will still vary on their income, if that makes sense. I hope I was able to explain that for you. I can understand it can be extremely confusing. However, it is very important to know about the healthcare system your country has because it affects you in so many ways. Therefore, pay attention to the news in regards to the healthcare policies that the Trump administration puts in place because it will change Medicare and Medicaid and the whole Affordable Care Act. and the country's healthcare policies as a whole. Thank you for watching.